If you're one of the millions of people battling the daily grind of knee osteoarthritis, you've probably heard the buzz about a treatment that sounds almost like science fiction: platelet-rich plasma, or PRP. The promise is pretty incredible, right? Using your own blood to heal your body. But the big question is it real hope or is it just hype? Today, we're going to cut through all that noise and see what the evidence actually says. Let's dive in.
I mean, the idea itself is kind of revolutionary, isn't it? What if the solution to your knee pain was literally flowing through your veins right now? That's the core promise of PRP, and it's a really compelling story. But you know what? We're not here for stories. We're here for the hard evidence. So let's put on our investigator hats together, because we're about to follow the clinical trail and find out if this thing is the real deal.
Okay, so before we get to the solution, let's get really clear on the problem. Knee osteoarthritis, or KOA, is so much more than just wear and tear. Think of the cartilage in your knee like the smooth, protective tread on a brand new tire. Well, osteoarthritis is a disease that basically wears that tread down, leaving you with a rough, painful ride that can seriously deflate your quality of life.
So how is PRP supposed to fix this? Well, you can think of it as a super concentrated dose of your body's own repair crew. We take a little bit of your blood, spin it down in this machine called a centrifuge to separate everything out, and we isolate the platelets. Now, these are the same tiny cells that stop a cut from bleeding, but it turns out they're also jam-packed with these powerful proteins called growth factors, and those are the real stars of the show.
All right, so we've got this liquid gold, this concentrated repair kit. How is it supposed to fix an arthritic knee? Let's pop the hood and take a look at the science behind it.
The actual procedure is surprisingly straightforward. It all happens in one visit. First, a totally routine blood draw, just like any other. Second, that blood goes for a spin in the centrifuge, which separates it into layers, kind of like a high-tech salad dressing. Finally, that golden platelet-rich layer is carefully drawn up and injected right where you need it, into the knee joint. And that's it. 3 simple steps, from your arm to the machine to your knee.
But the real magic isn't in the platelets themselves. It's what's inside them, these growth factors. Think of them like the foreman on a construction site. The moment they're injected into the knee, they wake up and start barking out orders, sending out this cascade of chemical signals to all the local cells, telling them to calm down inflammation, build new tissue, and protect what's left.
And check this out. This slide breaks down their 4-part mission perfectly. First, they act as peacekeepers, telling that painful inflammation to take a hike. Second, they're motivators, telling your cartilage cells, hey, get back to work, start building. Third, they're bodyguards, blocking the very enzymes that are trying to chew up your cartilage. And finally, they're mechanics, boosting the joint's own natural lubrication. It's like a full-scale intervention, all from that one injection.
So that all sounds great in theory. But how does PRP actually perform in the real world when it gets put to the test in clinical trials? Let's throw it in the ring and see how it stacks up against the other main contenders for knee pain relief.
First up is the old champion, the corticosteroid shot. And you know what? It's a knockout punch for a painful flare-up. It delivers fast, powerful relief. But here's the thing. It's a sprinter, not a marathon runner. The effect often totally vanishes in about a month. PRP is the opposite. It's a slow starter, for sure, but the evidence shows its benefits can go the distance, lasting 6 months, sometimes even a year. So the first choice is clear. Do you need a quick fix, or are you playing the long game?
Next up, PRP goes head-to-head with hyaluronic acid, or HA. You might know these as the gel shots that are meant to lubricate the joint. Now here, the evidence is pretty consistent. When researchers look at all the studies together, the conclusion is that PRP seems to provide better pain relief and better function than HA, especially when you look down the road at the 6 and 12-month marks.
But now for the main event, PRP versus a placebo. We're talking a simple saltwater injection. This is the absolute gold standard for testing a treatment. And this is where the story takes a very sharp turn. The RESTORE trial, one of the biggest, best-designed studies on this, delivered a pretty shocking verdict. At the 1-year mark, PRP was no better than the dummy injection. Now, both groups felt better, which tells you a lot about the power of the placebo effect, but that active ingredient in PRP, it made no statistical difference. And that result sent massive ripples through the medical community.
So, that result is a huge plot twist. How on earth can PRP consistently beat things like steroids and HA, but then fail to beat a simple saline shot in the best studies?
while the answer lies in this massive, hidden problem that's been lurking in the world of PRP research.
So yeah, this is the million-dollar question, isn't it? How can PRP beat other real treatments but lose to a fake one? It's a paradox that has left a lot of patients and doctors just scratching their heads. And the answer reveals the biggest secret, and frankly, the biggest problem, in the entire field of PRP.
And here it is. The name PRP is really misleading. We think of it like a specific drug, right? A 200 milligram ibuprofen pill is the same no matter where you get it. But PRP is more like the word soup. You can have chicken noodle, tomato, or lentil. They're all technically soup, but they have completely different ingredients and, of course, different effects. The recipe for PRP changes dramatically from one clinic to another, and that is the key to understanding all these conflicting results.
So let's just look at one of the main ingredients in the soup, leukocytes, which are your white blood cells. These are basically the immune system's attack dogs. Some PRP recipes are leukocyte-rich, which means you're injecting those attack dogs right alongside the repair crew. And, not surprisingly, that can stir up more inflammation and pain after the shot. The leukocyte-poor version, on the other hand, filters them out, which a lot of experts now think is a much better approach for the sensitive environment inside a joint.
And the variables don't stop there. It's like a choose-your-own-adventure for clinics. How many injections do you get? 1, 2, maybe 3? How concentrated are the platelets? It could be anywhere from 3 to 10 times the normal amount. Do you activate the platelets with some additive before injecting? Some places do, some don't. And who even gets the treatment? It seems to work better for mild arthritis, but it's often used on really severe cases. With all these variables, it's no wonder the studies are a total mess. We're not comparing apples to apples here. We're comparing apples to oranges to, well, back to soup.
Okay, wow. We've seen the theory, we've watched the clinical showdowns, and we've hit that big plot twist. So where does that leave us? Let's move to our final section and try to boil all this conflicting information down into a clear verdict.
Let's just distill all of this down into 4 key takeaways for you. First, it is safe. Because it comes from your own body, doctors call that autologous, the risk of a bad reaction is incredibly low. Second, who gets it is key. The evidence really points to it being most effective for mild to moderate arthritis, not those severe bone-on-bone cases. Third, and this is a big one, manage your expectations. This is not a cure. It doesn't regrow cartilage. It's about managing symptoms. And fourth, the benefits have an expiration date, typically lasting around a year.
So given all this complexity, it's really no surprise what the major medical organizations have to say. This summary from a very recent review pretty much captures the consensus perfectly. They remain cautious. Not because they think PRP is dangerous, but because the evidence is all over the place, thanks to that huge lack of standardization we just talked about.
And so we circle all the way back to our original question. But now we have a much clearer, a much more complex answer. PRP isn't a miracle cure, but it's not snake oil either. It's a low-risk option that's kind of stuck in this high-confusion evidence swamp. The ultimate question, then, isn't a simple, does it work? It's, is it worth the shot for you? Is it a smart investment to manage your symptoms and buy you some time, or is it just an expensive roll of the dice? And that, armed with everything we've covered today, is the perfect conversation to have with your doctor.